Good afternoon, everyone. We are about 1 minute out. Good afternoon, everyone. I'm Nirav Shah, the Director of the Maine CDC, and I'm joined this afternoon by Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Commissioner Wambrew and I are pleased to be with everyone today to talk about where we stand with COVID-19 for the entire state of Maine for today, Wednesday, November 3rd, 2021. I'll begin by providing an epidemiological update of where we stand, then talk about children's vaccines, and then turn things over to Commissioner Wambrew. We begin today's update on another sad and somber note. The Maine CDC is reporting 14 additional COVID-19 related deaths today. These include 4 residents of Androscoggin County, 1 resident of Aroostook County, 2 residents of Franklin County, 1 resident of Lincoln County, 4 residents of Penobscot County, 1 from Washington County, and another from York County. 4 of these individuals were women, 9 were men. 1 was between the ages of 50 and 59, 4 were in their 60s, another 4 were in their 70s, and 5 were in their 80s. Of these 14 deaths that we are reporting today, 11 of them are the result of our ongoing review of vital records or death certificates to ensure that we have the most complete and up-to-date epidemiological picture. 11 of these 14 are the result of that process. And of those 11, those deaths occurred between October 17th and October 25th. We'd like to take a moment to offer our condolences to the friends, family members, and communities of all of these 14 individuals. Right now, across the state, there are a total of 105,781 cases of COVID-19, representing an increase of 660 cases since yesterday. Cumulatively, 2,832 people have been hospitalized. And right now in Maine, 212 people are hospitalized with COVID-19. For comparison, 2 weeks ago, or 1 incubation period ago, 199 people were hospitalized. Right now in Maine, 76 people are in a critical care unit. 2 weeks ago, that number stood at 68 people in an ICU bed. And right now in Maine, 37 people are on a ventilator, whereas 2 weeks ago, that number was at 34 people on a ventilator. It continues to be the case that about 2 out of every 3 hospital people in Maine are not fully vaccinated. In terms of testing, our 7-day average PCR positivity rate now stands at 5.9%, and our PCR testing volume stands at 500 PCR tests that are being performed for every 100,000 people in Maine. Let's turn next to vaccines and vaccinations. Let's start with the population level numbers. As of this morning, 70.7% of the entire state of Maine is fully vaccinated against COVID-19, according to the US CDC. And 77% of the entire state has received at least 1 dose of COVID-19 vaccine. Now, Maine is currently administering 7,768 doses of COVID-19 vaccine every single day. What's remarkable is that that is a 99% increase, effectively a doubling just over the past 2 weeks, and a 50% increase over the past 7 days alone. What this means is that as we enter the next phase of vaccination, shots for children 5 to 11, we do so with the wind solidly at our back. Which takes me to the topic that I wanted to discuss with everyone today: the recent news around pediatric vaccination. Last night, the US CDC director endorsed the clinical recommendations from their expert group of medical and scientific advisors on the use of Pfizer's COVID-19 vaccine for children aged 5 through 11. Dr. Walensky's sign-off was the result of a thorough scientific review of the vaccine's safety and effectiveness. In effect, her sign-off was the last green light on the boulevard. Based on that recommendation from the US CDC, children in Maine may now start receiving the vaccine. I want to talk about two things today. First, why it's important for children to be vaccinated, and secondly, how you as a parent can go about doing that. Let's start with the why. Now, vaccination is one of the best tools that we have available to reduce the spread of COVID-19 and ensure that children not only stay safe and healthy, but can continue participating in the in-person activities that we know are important for their physical and mental health. I'd like to offer 5 reasons why vaccinating your child against COVID-19 makes sense. Number 1, the vaccine is safe. Hundreds of millions of doses of COVID-19 vaccine have already been safely administered in the United States. The vaccine for kids is a smaller dose than the dose that's given to adults. It has been proven safe in a clinical trial. Your child might experience some fatigue or a headache after one or both shots, but as with adults, that passes in a day or two. There is one safety concern that I've heard about from parents across the state that is on their minds, and I'd like to talk directly with people about that today. That is around a potential rare side effect called myocarditis. Myocarditis is an inflammation of the heart muscle that has been seen after the vaccine, albeit very rarely. To give you some numbers on that, so far, the US CDC nationally is aware of 877 reported cases of myocarditis in people under the age of 30. That is out of 86 million doses that have been administered. 86 million doses that have been administered. None of those individuals has died. And in a separate study, over 90% of them made a full recovery in a matter of days. Now, there were no cases of myocarditis in the clinical trial of the Pfizer vaccine for children 5 to 11. But I understand that for many parents, this remains the issue for decision. Here's what's really important to keep in mind. COVID itself can cause myocarditis. More than that, the risk of myocarditis from COVID is roughly 15 times higher than the risk of myocarditis from the vaccine. So let me put this in perspective. If myocarditis is your main concern when it comes to your child's health, the question on the table is this. With COVID at high levels in Maine right now, what's the greater risk? Is it from the vaccine, where the risk of myocarditis is around 10 cases per 100,000? Or is the bigger concern from COVID itself, where the risk is around 150 cases per every 100,000? To me, it's clear. The greater risk right now is from the virus, not from the vaccine. The second reason I want to offer is that the vaccine is effective. The clinical trials supporting this authorization enrolled 4,647 children between the ages of 5 to 11 and followed them to see if they developed COVID. After the analysis was done, the vaccine was found to be at reducing the risk of COVID. The reason why vaccinating your child makes sense is that vaccine can make a big difference in your child's life. Children can and do become seriously ill from COVID-19. Here in Maine, just in Maine, there have been 7,428 cases of COVID-19 just in children 5 to 11. That's 7% of all the COVID cases across the state. And given that there are 79,000 kids in Maine between the age 5 to 11, what that means is that 1 out of every 11 of them has had COVID-19. Of those children, 41 have been hospitalized for their COVID-19. That's among all children under the age of 18. And at least 12 of those 41 have ended up in an ICU bed. Right now in Maine, there are at least 4 children who are hospitalized and at least 2 in an ICU bed. Vaccination reduces your child's risk of getting severely sick or needing to be hospitalized. It also reduces the risk of other conditions associated with COVID, like one that's called multi-system inflammatory syndrome. It also reduces their risk of suffering from long COVID, which can also affect children. The fourth reason is that vaccinating your child protects others who you care about. Children who are infected with COVID-19 can spread the virus to others, even if they themselves have a mild case or don't even experience any symptoms at all. Vaccinating everyone in your household, now including kids 5 to 11, helps protect your whole family, including, for example, those who may have a compromised immune system or those who are yet still too young to be vaccinated. It makes, for example, the holiday gatherings that we're all looking forward to that much safer. And the fifth reason is that vaccination can save your family time and maybe even money. COVID vaccines are free for everyone, but getting sick from COVID can be costly. Once fully vaccinated, one tangible benefit will be that a child who is exposed to COVID-19, for example, at a school, need not quarantine, although they will still need to test. The ability not to quarantine has an immediate and obvious benefit, namely that fully vaccinated children, when we get to that point several weeks from now, those fully vaccinated children can be in the classroom more, and parents need not struggle to make work arrangements if their child was suddenly exposed and now has to quarantine for 10 days. This is important because kids have experienced a lot of disruption since March of 2020. Getting them vaccinated will make their lives more predictable and help restore a sense of stability. The second thing I want to talk about, that's the why. The next thing I want to talk about is how. How can you today start going about arranging for your child to be vaccinated? And the first thing to do is to find a location that's offering the fun-sized vaccine. In Maine, those places include, for example, community clinics, like the one in Sanford, operated by York County EMA, or the one in Auburn, operated there in partnership with Central Maine at the Auburn Mall. Another location might be pharmacies, including, for example, all Walmart pharmacies in Maine and a number of Hannaford pharmacy locations, as well as a number of Walgreens locations. A third option may be doctor's offices, including perhaps your own pediatrician or family doctor. And then the fourth option are school-located clinics that Maine CDC, Maine DHHS are planning in partnership with the Department of Education and schools across Maine. Now, if you need help finding a location in your area, please visit our website, maine.gov/COVID-19/vaccines/vaccination sites. That's a bit unwieldy. It's just as easy to go to Bing and search for Maine COVID vaccine site. And that'll take you to a website where you can put in your county, the age that you're looking for, as well as the type of clinic you're looking for, and see a list of sites that are in your area. Please check back often because additional sites will be added as they go online. And the last thing I want to close with is what to expect after your child gets their shot. After the visit, as with adults, children might have some side effects. The most common ones include things like redness or soreness at the injection site, as well as feeling tired and maybe having a headache. As with adults, these typically go away in a day or two. The arrival of children's vaccines for those children aged 5 to 11 is a big step forward. It now gets us that much closer to making sure that children in that group can enjoy the benefits of the vaccine, and it recognizes that COVID-19 is now a vaccine preventable disease. Thank you all for giving me some time there. Commissioner Lambrou, I'd like to turn things over to you.
Thank you. So I'm excited to announce a new initiative aimed at helping kids learn about the newly authorized COVID-19 vaccine. The Maine Department of Health and Human Services, in partnership with the Department of Education, is launching a video competition for Maine children to encourage COVID-19 vaccination. Maine youth ages 5 to 17 can submit a 30-second video to encourage other kids along with their parents to get the COVID-19 vaccine. This could include, for example, information on the vaccine's safety and efficacy or the impact of not getting vaccinated. The Maine Center for Disease Control and Prevention will promote winning videos through public service announcements and on social media. Additionally, the school that the winners attend will receive $50,000 for the first place winner, $25,000 for the second place winner, and $10,000 for the third place winner. Schools can use these winnings to supplement school meals with healthy treats, purchase playground or music equipment, or support a school field trip, for example. Information on submitting an entry is available on Maine's COVID-19 website. The deadline for submissions is November 22nd, and we'll announce the winners on December 1st. We invite Maine children to help us spread the word about the benefits of vaccination and look forward to their ideas and creativity about how to best reach their friends, their parents, and their communities. With that, I'll turn it back over to you, Dr. Shaw.
Thanks, Commissioner. I know our colleagues in the media had a late night last night, so we appreciate everyone being with us. To kick us off today, I'm going to turn it over to Patrick Whittle.
Thank you very much. I have a couple of things. There's been some reporting recently, including by Mel Meyer of WGME, about hospital capacity, and that some patients have had to be transferred to facilities out of state. Can you tell us a little bit about that?
Sure. So we continue our work day in, day out on healthcare workforce in Maine. This is an issue that predated the pandemic, but was exacerbated by the pandemic. We now have nearly 7,000 healthcare workers who have tested positive for COVID-19 and thousands more who have not tested positive, but have had to be off the job due to the requirement of quarantine. This pandemic has strained our workforce, led to early retirements, and had this kind of impact. But we're excited by the fact that we have seen the rates of vaccination among our healthcare workers rise. We are working with Maine Health, all of our healthcare facilities in the state of Maine, both broadly on policy options to try to address the staffing gaps, as well as one-on-one to see how we can help provide flexibility, resources, or kind of technical assistance to have them get from point A to point B. We know it's a challenge for the healthcare workforce across the state of Maine. It's a challenge for the workforce across the state of Maine as we're in this phase of the pandemic, but we continue our aggressive work with our hospitals to maintain our hospital capacity, which, as we report out, we continue to have, over 50 available ICU beds in the state of Maine.
Okay, thank you. Two more quick things. The University of Maine system recently released that its immunization rate for COVID-19 for students is about 98%. Could either of you speak to how they've been able to achieve that, and sort of how that stacks up to private universities in the state, if you have access to that information?
Sure. I don't think we systematically collect the rates of vaccination among students at Maine colleges and universities. I will say that the majority of them do have a requirement for their students to be fully vaccinated as a condition of attending their colleges and universities. This is the same sort of requirement we've seen at hospitals, even in advance of our healthcare rule. We've seen in different private sector businesses. And I think it's safe to say that those policies tend to result in very high vaccination rates.
Got it. And speaking of that, with COVID-19 vaccines coming online for elementary age students, can you speak to what kind of policy changes there could be at the state level in terms of requirements and things like that?
Well, look, we are just so excited about the news less than 24 hours ago about the authorization for kids 5 to 11. Our goal today, our entire focus today and in the coming days, is access and education. How do we make sure we provide access to the COVID-19 vaccine with these different dosages for the younger children, as well as continue our work for those 12 to 17, as well as provide the education for parents who still may have questions about that vaccine. That's where we are today. We'll cross the bridge about what we do next later.
Okay, thank you so much.
Thank you.
Thanks, Patrick. Let me go over to Megan at WMTW next.
Thanks for taking my question. So a lot of school clinics and vaccine clinics for the childhood vaccine inside schools is happening, next week-ish, a little bit after. I know from personal experience, November 17th would be the day that in my child's school. Anyway, point being, in order to be considered fully vaccinated, it wouldn't happen before Thanksgiving. So does that mean that, group gatherings for Thanksgiving should be considered as if your child weren't vaccinated or didn't get that first shot, if they in fact did get that first shot?
Well, Megan, that's a good question. You're right insofar as no child in Maine in this age category will be fully vaccinated by Thanksgiving. That's not a reason to put it off, and I know you're not suggesting that, but it's a reason to start, because we know that there's a benefit to being vaccinated even after the first dose. So if all the children in the household, all the kids that are going to be there for Thanksgiving have at least their first dose on board, the gathering is that much safer. How much safer? It's not easy to calculate. The clinical trials that look at these things really go off of what do we know the differences are after someone is fully vaccinated. But when you really scrutinize those data, as the CDC and FDA did, you see that there starts to be a benefit that accrues even after the first dose. What I would recommend when we get to indoor gatherings of all stripes, be it Thanksgiving or otherwise, is that until and unless a child is fully vaccinated, you work with them as if they were not vaccinated, but know that the risk is not the same. Vaccines are really that powerful. They start working quickly. This year's holiday gatherings, particularly Thanksgiving, will be notably different and safer than last year's. But at least for those kids who are in the process of getting vaccinated, I wouldn't pull off all the protections quite yet.
Thank you. Also, question, and you may have already mentioned this, but just a little bit of clarification, or if you wouldn't mind repeating it. The jump in vaccination rates, do you think that that's largely because of the healthcare mandate? Is that the contingent that's making up the difference, or is that you're seeing getting vaccinated?
Well, on one hand, that's a possibility, but I think it's important to note that the deadline for healthcare workers was not last week, but October 15th. So because they had to be fully vaccinated by last Friday. So it's not clear if that was driving it or not. There are other potential factors with the continued presence of the Delta variant, high levels of hospitalization, COVID just being more in the, perhaps more top of mind for folks. That could have been a driving factor as well. But either way, we're excited by that. And I think it sets us up for a good position to start vaccinating 5-year-olds.
Thank you.
Thanks, Megan. Brian Sullivan, over to you.
Thank you, Dr. Shaw. I wonder, I know we're focused on 5 to 11-year-olds today, but I wonder what comes next with the other segment of kids 4 and under. Any work there? And can you just talk a little bit about what that might look like? I'm sorry, I have a kid in that age group, so I'm interested to know.
Understood, and I appreciate the forward-looking approach, Brian. Those trials are still underway. That's the bottom line. So the next group of children that are being studied are those down to 6 months through the age of 4. And that group, the clinical trials are still underway. I don't yet know when they will be fully enrolled, when the data will be available, to say nothing of submitted to the FDA and the CDC. What I've been told is that it'll be 2022, but I don't know when in 2022 at all. It's a good question. Certainly the next frontier, but right now we're focused on 5 to 11 and getting them squared away. But you're right, it's time to start looking to the next thing.
And my second question would involve, I guess, the overall state of the state. When you take in the hospitalizations, the ICU, and the ventilator. And I think a couple of weeks ago we talked about perhaps signs that things were going in a direction that would have seen those numbers go down, but they seem to have hovered right around those above 200 for hospitalizations. What are you seeing that's keeping that going, and maybe what lies ahead here, if you can look a little bit down the road again?
Yeah, you all know my reticence to speculate, but Brian, as you recall, as we talked about a couple of weeks ago, the question on the table was whether Maine would go the way of some parts of the world which had seen at that time a continued decline in cases, or whether it would go the way of the UK, which had come down a bit and had, for at least at that time, existed at a high plateau of cases. And what we've seen over the past few weeks is that although we've pulled off of our highs from mid-September, we are still at a high plateau, akin to what the UK experienced 3 or 4 weeks ago. We're now starting to see that play out here. It's notable that even in places in the globe where case numbers had gone down significantly, like other countries in Western Europe, as well as states here in the US, they are starting to see things start to tick back upward. That's concerning, but I think the bottom line remains that vaccination is the key. For example, Brian, as I noted, right now in Maine, of the 212 people that are hospitalized, 2/3 of them are not fully vaccinated. For those who are fully vaccinated, they can still experience a breakthrough case, although it's relatively less common. Getting vaccinated is still the key. And that is ultimately going to be how we find our way out of the pandemic in Maine, nationally, internationally as well.
Thank you.
Let me go over to Emily at the Sun Journal next.
Hi, good afternoon. I want to start with a quick clarification. So the vaccines for kids is a smaller dose than adults. Is the vaccination for 12 to 17-year-olds also a smaller dose, or is it just 5 to 11?
Just 5 to 11, Emily. It is 1/3 of the dose that is used for adolescents and adults.
Okay, got it. And talking about the rollout of these vaccinations to kids, maybe this is a question for Commissioner Lambrou. How are you working with schools are there plans to host on-site clinics, any sort of like awareness campaigns that you're going to do through schools, that sort of thing?
Yes, yes, and yes. We are doing all of the above with our colleagues at the Department of Education. We have been building on their school nurse infrastructure. They have regional plans to try to look county by county, working with our public health liaisons in the same areas to do a mapping exercise to try to match schools that are interested in hosting clinics on site with local providers who have the capacity and interest in doing so. So you'll begin to see those pop up both from the school officials as they send that information out. Some of those will be posted on our vaccine website, and we have also been working with them on education all along. So we will be accelerating that work in the coming weeks.
Great. And that was kind of my follow-up question are these communications coming from the school, from DHHS, or both? Like, can I click on the DOE website and see, okay, these are the schools that are doing clinics?
So
Sure.
my understanding is that the schools themselves will be doing most of the work, since it's their communities, and they'll be the most effective messengers. We will also be on our vaccination website, where you can find information on vaccines, posting some of those clinics, because some of those will be open to their communities.
Okay, got it. Thank you both.
Yep, thanks, Emily. Let me go over to Corey from WAGM.
Good afternoon, Dr. Shaw and Commissioner Lambrou. My first question is the state handling the distribution of the smaller doses vaccine for kids there? And if so, sorry, I mean myself. Is there any concern about maybe having a shortage of that specialty supply there?
Sure. And Corey, when you mentioned the specialty supply, you meant the supply of the vaccine itself, right?
The smaller doses, yes.
Yep. So the way that the distribution system for these vaccines works is that right now, the states are given, each state is given an allocation of how many doses that they will receive. And that's based on the relative ratio of children 5 to 11 in that state. And then we at the public health department order doses on behalf of providers. Once those are ordered, the federal shipment process drops the vaccine directly off at the provider's locations, not with just the vaccine, but also the syringes and other supplies that are needed to administer it. Right now, Maine has ordered in our initial allocation about 34,000 doses, 33,900 to be exact. That does not account for roughly 16,000 doses that are going directly to the pharmacies that I mentioned, like Walmart and Walgreens and Hannaford. They are getting a separate allocation. Although we're always concerned about the supply, based on where we are right now and what we expect to see for the uptake in the next few weeks, we believe that there will be sufficient amount of supply for first and second doses for every parent of every child in Maine who wants to get their kid vaccinated.
Thank you.
Thanks, Corey. Let me go to David from the BDN.
Thanks, Dr. Shaw. Children are always getting different kinds of vaccines, different than the COVID vaccine, but parents generally see this one as qualitatively different. And I think the emergency use authorization is a big part of that. What would you say to parents who want to wait until full authorization before giving this to their 5 to 11-year-old?
Yep, David, we hear that concern a lot. And here's I guess what I would say, and it's similar to something you've heard me say before, which is based on where we are right now, with hundreds of new cases every day, and over 7,000 cases already among children between the ages of 5 to 11. The question on the table is, what's the greater risk? The greater risk to your child and the disruption in their life, the vaccine, or is it the virus? And we've already seen how much COVID has upended schools, the number of outbreaks, the number of cases, the number of days in quarantine, the lost sporting events. To me, the vaccine has been demonstrated as being one that's safe. It's been extensively studied, and the larger dose has been administered to hundreds of millions of doses that have been administered across the country, to say nothing of billions of doses across the globe. So for me, the safety question is really one where all signs point to the vaccine. I understand that folks want to wait, but waiting comes with a risk that their child may be exposed to COVID-19 and suffer some of the consequences that sadly we've seen in our state.
And
I guess, David, just to put a finer point on that, David, again, I get the question. I don't want to dismiss it, and I want to treat it with respect. But the other thing that's been compelling to me, David, is in the past couple of weeks, couple of months, without fail, 100%, every single doctor, pediatrician, family practitioner, nurse practitioner, every single specialist that I've talked to who is entrusted to care for kids has told me uniformly that when the vaccine is available and authorized, as it is now, they were going to get their own kids vaccinated. Uniformly, that's been the word I've received. These are the folks that we trust to care for kids. For me, why wouldn't we trust them? If we trust them for everything else, why not trust them for the vaccine?
I appreciate you answering that. My second question is, a Kaiser Family Foundation poll found about 27% of parents nationwide want to get their 5 to 11-year-old vaccinated immediately. Do you have any sense of what that number is in Maine, if it's higher or lower than that, what you've heard so far?
I don't have a quantitative answer, David, only a qualitative one, which is that when those studies were done a year ago, or those surveys were done about a year ago, what we saw is that they underpredicted the uptake and the demand for vaccine in Maine. As you'll recall, about a year ago, Kaiser and other groups were doing similar surveys of adults and their willingness and desire to get vaccinated. And what we saw was that the national numbers underestimated what the demand would be in Maine, as evidenced by our nation-leading vaccination rates. So I'm optimistic, hopeful that we'll see similar robust demand for the childhood vaccine.
Thank you so much.
Thanks, David. Let me go to Catherine from the Maine Wire.
Good afternoon, Dr. Sean. Thank you for taking my question. I'd like to change topics slightly, if I may, to the healthcare worker vaccination rates. Since Maine CDC first began reporting that data via its online dashboard in May, there are approximately 9,000 fewer workers whose vaccination status is being reported on. And I'm wondering what the difference in that number can be attributed to, and whether the agency has an aggregate number of workers who are no longer in the healthcare workforce.
So I'll try to answer and say, I would have to look up, I can't affirm the 9,000 number. What we have been doing is since June, having our hospitals, nursing facilities, certain other licensed facilities report in on their rates. Their own workforce ebbs and flows all the time. We have changes in capacity. We have seasonal residents, as a reminder that our population in Maine goes up in the summer, as does some demand for healthcare, et cetera. So there's always going to be a fluctuation. We do expect to have our October healthcare worker vaccination dashboard updated, hopefully next week, so we'll be able to give a better snapshot of what's going on with it. But its purpose was of the workers who are in those facilities now, what percent are vaccinated. It's not a survey intended to do anything else.
Okay, and if I can just follow up quickly, obviously the mandate doesn't cover all healthcare workers in the state. People who work at private practices or practice telehealth, and travel agencies and places like that aren't covered. Does the state have any idea what vaccination rates are like in those agencies that aren't covered by the mandates?
Not at this time, but our plan is, as we transition from, again, that survey we launched in June as a tool to give us information. About the same time, organizations like the Maine Hospital Association urged us to add COVID-19 to the set of vaccines required for all their healthcare workers, which we did in August. We're going to be transitioning that survey from a survey and a dashboard for information's sake to a reporting tool that will cover all the designated healthcare entities subject to the rule. So that is forthcoming.
Thank you.
Thank you.
Let me go, thanks, Catherine. Let me go over to Rachel Ohm next.
Hi, thank you. I was wondering, Dr. Shaw, if you can speak about the number of deaths that we've been seeing reported lately. It seems like there's been an uptick, and I'm just wondering, is that because of the records reviews, or are we actually seeing an increase in deaths, and why is that?
Yeah, that's a great question, Rachel. Our team and I we've been talking about that to try to get a better handle on that. We're actually working on more analysis around those because we've noticed the same trend as well. So I don't have the benefit of that completed analysis for you today, but we are starting to take a closer look. We've seen that trend over the last several days, and we want to get a better handling and understanding on it. There are a few things that I can note, however. The first is, as you mentioned, the vital records review. That has been ongoing throughout the pandemic, and that's not a new feature. Although it has detected more cases lately among individuals who have died, That's not a new feature. We've also seen that more of the deaths are from rural areas. But again, what we're working on, Rachel, is to try to quantify this a bit more, both on the geography, where they're dying, a bit more on the age breakdown, so we have a finer sense, as well as to try to get more information on their vaccine status. So I'm hoping sometime very soon to be able to discuss that in much greater detail.
Okay, so do you have any indication now about their vaccine status? Like, could you say like most are unvaccinated or?
That is our hypothesis, but I can't affirm that right now. We have to go through manually, and we have to look up every single one and then confirm it. So it is a manual process, and then we have to check it against other records to make sure it's true, and so on and so forth. So that is our hypothesis, Catherine. I'm sorry, Rachel, but I can't affirm that right now.
Okay, thank you.
Thank you. Let me go to Evan next. Evan Pop next.
Hi, Dr. Shah. Thank you. I understand the federal government has invoked the PrEP Act to allow pharmacists to vaccinate younger children. And you've mentioned that pharmacists are part of the plan for child vaccinations in Maine. We've heard from some parents that they've had appointments for flu shots canceled because pharmacists believe that they weren't eligible to give young kids a vaccine. And so I'm wondering, are you coordinating with pharmacies to clear this up, and can parents be sure if they make a vaccine appointment at a pharmacy that it will be honored?
Sure. The best thing to do is to double check with the pharmacy. But here's the bottom line. Under the PrEP Act, as you noted, pharmacists in Maine can provide vaccines, including that for COVID-19, for children down to age 3. I have heard a few reports, as you noted, just having seen them on social media. We haven't heard any systematic or seen anything systematic suggesting that pharmacies are routinely doing this. But the best thing to do for a parent who just wants to double check because they've taken the time to make the appointment is to call the pharmacy and make sure that when they arrive, their child will indeed be able to get vaccinated. Evan, I'd be remiss if I didn't mention something here. You mentioned the flu. Just to bootstrap on your question a bit, for parents out there, it is possible, it's advisable to get your child vaccinated both for COVID as well as for influenza. You can do so at the same time. They can get one shot in each arm on the exact same day.
Great, thank you.
Thanks, Evan. Let me go to Patty White next.
Thanks, Dr. Shaw and Commissioner Lambrou. Can you say when you expect the effort to give shots to kids to be fully up and running between on-the-ground infrastructure and the doses on hand? I don't know when we're supposed to receive those 34,000 doses.
Sure, Patty. They're coming in on a rolling basis. The first doses started arriving in Maine yesterday, and they will continue to arrive throughout the week from the federal government. As Dr. Walensky last night in her statement approving or recommending these vaccines noted that it will take a bit of time for this machinery nationwide to be fully spun up. That's partly because the vaccine is still on its way to some places, even though it started arriving. Similarly, there's still some administrative things like clinical advice documents that the CDC is yet to put up on their website. We're expecting much of that to happen today. So although vaccines are starting in Maine, I've already started seeing posts on social media of folks who have gotten their kids vaccinated in Maine. We anticipate that by next week, the machinery will fully be spun up. For example, that's when the school-based clinics will start. And they're there too. They're going to start gradually, and they'll be building up over the week of the 8th and over the week of the 15th. So okay, I guess the corollary of that, Patty, is that we ask parents for a bit of patience. We know that you've been holding out for so long, awaiting your kids and waiting for them to have the chance at getting vaccinated. What we're asking is that you hold on just a bit longer while all the pieces come into place.
Thanks. And then in terms of the increase in vaccinations over the past couple of weeks, what proportion are first doses versus boosters? I know maybe a month ago it was a lot of boosters and then that was kind of dissipating. What are you seeing now?
As of this morning, Patty, over the past 7 days, 74% of the shots that have been given in Maine are primary series, first or second, and 26% are boosters, third doses.
Great, thank you.
And that's over the past 7 days.
Okay. Thanks.
Thanks, Betty. And over to Chris Costa. Chris, did we answer all your questions?
I wish, but yes, most of them have been asked. I do need a little bit of clarification, if you don't mind. I've heard two different numbers on the number of kids between the ages of 5 and 11. Dr. Shah, I think you said 79,000. There was a press release that was sent last night that said 96,000. Can you just help me understand what the number is and why there's a difference there?
I
do that
thought it
one.
was 70. Okay, Commissioner.
So we got the 79,000 from our Department of Education colleagues because we were working at one point on school-based clinics. So that was the number we were working on for school-based clinics. The 96,000 number is the number that is going to be on our dashboard. We expect to be reporting kids 5 to 11 beginning next week when we get sufficient numbers to do so. And that is our census number of kids in the state of Maine who are ages 5 to 11. So sorry for any confusion.
No. Okay, so I think I understand. So the 96,000 is all kids 5 to 11, but that 76,000 was based on what kids going to places where a school-based clinic would occur?
79,000
Oh,
was
sorry,
kids who are in public schools.
Okay, got it. So, just to kind of clarify off of Patrick's question, no indication at this time, or not ready yet to talk about potentially making the COVID-19 vaccine a required immunization for attending public school. Is that right?
Not at this time. You know,
Okay.
we will consider that, but I'm going to go back to phase one is this making sure we make the vaccine accessible and easy to get for all those parents who are ready to get their kids vaccinated. Part two is going to be the education effort for those parents who still need more information to get those kids vaccinated. That's part of the reason why we're very excited about this kids video contest, because we think kids may be the best messengers to talk to each other about why, for example, a high school student who got the vaccine thinks that their younger brother or sister should get it, or why a younger kid can dispel that myth of a vaccine for other young kids. So we're looking forward to that. I will remind people that the vaccine is free. We continue to say that. There should be no concern about costs. And I think we will reassess when we get through those two phases to where we are in our vaccination of kids.
Okay. And Dr. Shah, you had mentioned about 33,900 doses, and then, that are coming directly to the state, and then an additional 16,000 that will be going to the federal retail pharmacy programs and other federal programs. So I guess when you kind of do that math, we're looking at about 50,000 doses in what's considered the first shipment over the course of this week. So 50,000 doses, roughly 96,000 kids in that age group. That sounds about like 50% of kids in that age group could potentially get the shot in this first week if they wanted to. Is that kind of your understanding, and what's your reaction to those numbers?
Yep. Generally, that's right, Chris. A couple of footnotes or asterisks. There's also a third allocation stream that I failed to mention, which is one that will be going directly to Indian health service providers. And so I'm not sure what their allocation is, but that's another form of ways that providers in Maine can get the doses. But in general, you're correct, Chris. That's we're looking at about half the supply that we would need to furnish first doses coming into the state this week, with additional doses being made available just starting in a couple days from now on Monday and Tuesday for ordering. Maine will have the ability to order approximately 12,000 doses for state allocation, with a number for pharmacies that hasn't yet been set yet. So I think that puts us in strong position. Although I want every single parent out there of a kid 5 to 11 to start making plans to vaccinate their kid. Even if every single one did, we still wouldn't be able to accommodate all of that within a week's time. So given what we can do and what our system is well prepped to do, we still will have plenty of vaccine.
Okay, but you said puts us in a strong position, right?
It does.
Okay.
Although we're working tirelessly to make vaccines available, thankfully, supply is not the constraint that it was, say, back in January and February.
Okay. And then my last question, and I'm sorry for having so many, I just had some clarifications, but this is my last question. Last week, we had talked about the potential of this happening, kids 5 to 11 being able to get the vaccine, and then being able to get rid of masks in schools. Now, last week you had said this is going to be tough. And I think you had referenced Dr. Walensky in saying, one, not every kid may get the shot, and two, kids may get the shot at different times. So not everybody will be fully vaccinated on the same date. So I guess I just wanted to check with you, is there a threshold or a percentage of the population by campus? I imagine this works kind of similarly to the county by county approach, right? You know, if only a certain percentage of one campus is vaccinated, you would have to be aware of that when talking about removing masks. So I guess, is there a number you're looking at for each campus to be fully vaccinated?
It's too early to say, Chris. So I'll provide a bit more depth or a bit more detail there. One of the things that our team, as well as teams at health departments across the country, have been working on is this exact question. What is the future of COVID, particularly now that kids 5 to 11 can be vaccinated? What does that mean for schools? What we've done is ask the CDC to help us think through a systematic approach, a unified approach that would give states these exact sorts of mileposts and off-ramp markers. So for example, when you think about schools and masking, one potential metric is what you noted, which is the vaccination rate in the school. Maybe it's the vaccination rate in the community that matters, or maybe it's a hybrid of the vaccination rate and the case rate over 7 or 14 days. There are so many different ways to slice that. The US CDC actually has a brand new group of expert epidemiologists who specialize in this exact type of thing. I actually had the privilege of having a call with one of them yesterday evening to talk about these exact types of off-ramps for schools and others. We're working with the CDC to better understand that and have metrics. We don't have any, or neither does the CDC have those quite yet, but that's the state of the discussion. It's the right question to be asking. It's the one that's on everyone's mind, but we want to do it systematically and recognize again that although I want to be forward-looking, right now in the here and now, we're focused on getting kids vaccinated.
For sure. That was what you talked about last week, right? You had a call with the CDC to discuss those metrics. That the one you're referencing?
Actually, it's a subsequent one to the one that I had a week ago. We've had a more detailed one to really think through what this tool, what this analytic approach would need to say to make it actionable for states.
Cool. Thank you both for your time.
Thanks, Chris. And thanks to all of our colleagues in the media for their time today. Commissioner Lambrou, I'd like to turn things over to you to close us out.
Great, thank you. So on a related note, this week we launched Coverme.gov. For the first time, Maine is fully running its health insurance marketplace, where people who purchase insurance on their own can shop for and enroll in coverage. By running our own marketplace, the consumer experience is tailored for Maine. Our website is designed with local feedback. We run our own call center, and we are better to get able to reach those Maine residents, especially those who are uninsured, who may struggle with health insurance coverage. And this year, there is even greater financial assistance than ever. More people will qualify for lower premiums, and people who currently receive financial assistance may get more of it. Over 70% of people can find a health plan for less than $50 a month. And so far, it's going well. Since the launch of open enrollment on Monday, November 1st, 8,500 people have visited coverme.gov, 3,500 have newly created accounts, the first step in enrolling, and 50,000 people, over 50,000 people in Maine, have gotten renewal notices because they were in the marketplace in 2021, and we want them to come back and check out their options. The ongoing COVID-19 pandemic, coverage is more important than ever. All it takes is one serious illness, one accident to wipe out your life savings or to make it harder for you to send your child to school. We know that people continue to have to make hard choices between food and prescription medicines. So if you are uninsured, if you need some help getting coverage, visit coverme.gov or call 866-636-0355. Thank you.
Great. Thank you, Commissioner. And thanks to everyone for taking some time out of your afternoon to hear about where we are with respect to COVID. We look forward to chatting with everyone again soon. In the meantime, please be kind and take care of one another. We'll talk again soon.